Hi, everybody. It's Mo Bhandari again from Ortho Evidence, and I'm here this morning, but it's evening in India with a colleague and friend and current chairman of the Sancheti Hospital, Dr. Parag Sancheti. Parag, welcome this evening.
Thanks for having me on the Orthopod podcast.
Oh, no problem at all. And certainly, the thanks goes to you. I know we're hearing lots around the world about various countries. India certainly is in the forefront of lots of policies and changes, and certainly they've been doing lots to try to combat what we're all trying to do. I wonder if you could give just a brief picture of what it's like right now in India.
So our Prime Minister increased the lockdown. We were supposed to end today, 14th of April, and tomorrow things were going to open up, but he just added 3 more weeks about to it. So now we are completely closed down the whole country up to the 3rd of May, and hopefully on 4th of May we may open up. And when the close down did happen, everybody felt that it was a little bit early that it happened, but I think that was the most appropriate thing our government did, and that is what has helped us. So as of today, we have about 9,500 COVID positive patients. We've had about 350 deaths till date, and more than 2,000 have recovered. So some of the testing may not be so much. The numbers might be a little more than what they are on our site, but the number of deaths are actually the right figure. So I would go that the number of deaths are not as many as we thought they would be. So we are in right now a okay situation.
So Parag, when you're into a complete lockdown, there are different that means different things to different people. So for example, in Canada and the US, when they use the word physical distancing and lockdown, it still means that you're in your house, you can walk outside, you can still be with up to 5 people, but you must be distancing 6 feet. And that's causing difficulty in many countries. What does a lockdown look like in India?
So in India, it's very strict. You can't go out of your house. If you're staying in a society or an apartment, they would be screening how many people go out, how much time they go out, how much they come in. Once you're on the roads, the police will stop you. So all the essential healthcare workers have been given a QR code. So I have a QR code because I have to go to the hospital, and unless I have that, I cannot really go out of the house. So they're very strict, and if they catch someone who just wants to go somewhere, they will be fined. And in the initial days, the police were actually hitting people because
we saw some of those videos. I mean, it is a deterrent, right? It's a very serious deterrent.
That has helped us actually. So it's very strict. Unless you can just go out to get some food essentials, you can go to buy medicine, because the only shops open are the food shops, the grocery shops, and the medicine shops. Everything else, including the liquor shops, and everything is completely closed and is being followed very strictly. No vehicles on the road at all. You cannot go out. So it's a complete lockdown.
So how has that impacted then the hospital? Obviously, for those who aren't aware of your situation as chairman of orthopedics of the Sancheti Hospital, I mean, you are running this 250-bed hospital and a very prominent hospital within the area. So what's happened with hospitals?
Yes, so I'll tell you a little bit about Sancheti hospitals, and which can be extrapolated to other private hospitals. Sancheti hospital is a little different. It's a pure orthopedic and a trauma hospital. So we don't see patients which are non-orthopedic patients. So we are not getting any patients who are COVID suspects or patients with fever and body ache and things like that, because it's a pure orthopedic hospital. Our work has completely come down to just 5 or 10%. 80% of our work was elective work, like TKRs, total replacements, ACL reconstructions. That has completely stopped. We by law, we cannot do any routine procedures. The government has stopped us from doing routine surgeries and routine clinics. So all we get is the emergency trauma, dislocations, infections at time, or acute pain, low back aches, radiating pain. So these patients we are seeing, but otherwise it's a complete slowdown of work. We are working just at about 8 to 10% of what we were doing. Admissions have come down very drastically. and it's a situation where the hospital looks as if deserted and completely less work.
So, Parag, I mean, clearly, you sit on both sides. You sit on the front end side of, managing COVID in patients who are going to be coming into orthopedic issues, but you also are managing a hospital infrastructure. You know, from the economic point in India, how long can this go on for businesses and hospitals and situations? I mean, is there going to be a point at which it's going to be a non-recoverable situation? Or like, are they giving you any insight? Now you're saying May 4th. We've just gotten off the phone with individuals from Singapore who have been told no elective surgery likely until September. I mean, they've just basically said there's no surgery happening. So you can see this thing kind of rolling and forward. Is there a point or a discussion at which it becomes really problematic for economies?
Yes, so as far as the hospital is concerned, we probably will start doing routine surgeries after third. I think we cannot afford a complete shutdown after 3rd of May. Work has to start. To answer your initial part of the question, it's impacting us hugely. India is a third world country, and a big chunk of our population stays on day-to-day earnings. And these people are being supported by the government, are being supported by NGOs, are being supported by entrepreneurs and through the CSR accounts, the corporate social responsibility. But how long can that go on?
Right.
So there's already people who are feeling the pinch, and if the close down, the lockdown goes beyond 3rd of May, then there will be a little bit of revolt. There may be some riots, and things might get out of control because these people are really hand to mouth. So that's how they work.
Yeah, it's a very tough situation. I think we often look at it as the balance between life and safety, and obviously sometimes when you feel good, you feel I can just go out and do things. Why are they stopping me? But it's for the greater good, I think. And sometimes it's hard because it's having a massive impact. I know this is the issue being struggled with everybody. But let me ask you this now. I know you for many years, and we've chatted lots and lots about the system and life and how we live our life. How has this impacted you personally? I have some ideas, but briefly, like when you look back at lessons, I'm sure you're reflecting as we all are. What are things that are coming to mind for you now when you think about the situation we're in?
Yeah, so for me, it's actually a comfortable life, and I would say that for 3 to 5% of people like me, they are doing fine. We are sitting in the houses. We have food to eat. We have a cover. We have a car to go to the hospital. But it's not really the same for everybody else. But that being said, for me, what I have done because of this close down is there are many things which I really wanted to do, and we always used to put it away that I don't have time. So I made a list of those things, and I'm working on that. I'm trying to learn the accounts and trying to understand the balance sheets and the profit and loss thing, which I never had time for. The second thing what I'm trying to do is work on our website. I always wanted to make our website very good. I never had time to look at it, and trying to exercise more, trying to stay fit. Every day morning I get up, I've made a timetable of what to do, and working on that timetable. It's trying to do as much as what I did before. I'm also seeing patients on teleconsultation, so seeing about 15 patients every day. So that also is helping, spending more time with the family. And now it's 3 weeks over. How much time can you actually spend? So it's also is getting a bit saturated, and we're waiting to get back to normalcy. But all I can say is that my father always says convert liability into asset. So this is a liability, and we are trying to convert into asset. We had Zoom meetings with our staff and the top management and the doctors. And what I feel, Mohit, is going to happen is there are going to be 3 distinct eras. One is the PC era, the pre-COVID era, which is behind. We are actually in the COVID era right now, and one will be the post-COVID era. So, we are in the situation, and what will happen after a few months is we will be saying that when we were in this era, that happened and that happened. But the challenge is going to be once this all settles down, the kind of economic loss it has made to the country, to the hospital, and to each individual in terms of his own life and his own business is going to be difficult to recover. So I think the post-COVID era is going to be challenging, and now is the time we have to spend on thinking on how we can, overcome this challenge, because it's not that on 4th of May this virus will leave the earth. This virus is going to stay in around here for a long time, like we had the flus, the other vaccinations. Unless the vaccination comes, we really will not be able to completely live without it. So we have to accept this challenge and find out ways to face it and move on with it. So that's how I've been thinking about my personal life and the way ahead. It's going to be a difficult time, but hopefully we'll come over it and we will come out winners.
Yeah, and I think you state what I think what I'm feeling as well, which is we have this precious time to do something with, but there's also a sense sometimes that it's made many of the orthopedic surgeons that I've interacted with around the world start to wonder about if they didn't have direct orthopedic care, how would they live their life? Because this has forced many surgeons into a situation of stay home, and you, despite your desire to want to be in the hospitals and help and care for patients like you have before, that's no longer allowable, and that could no longer be allowable for weeks, if not months. We hope not a year, but definitely in the months period. It's making us all reflect back and say, well, how do you spend that time meaningfully so you find progress? And I love the idea of taking the liability and making it into an asset, because I think we often think sometimes of negatives, but there is a positive in this. There'll be gifts from this virus, as much as we don't think of it as a gift, that are going to change the way our society and humanity thinks. And I hope it's for the better.
Yeah. So life is going to change a lot. In many ways, people know that there is an option of work from home, and especially for my other colleagues, who are in the IT industry, who are in the building industry, who are, finding out ways to work from home, and they're actually managing it. So I think that one particular way is going to impact us a lot. The second thing, what is going to happen in the whole situation is because of the slowdown, we will also have to see what our outgoings are going to be, what are the incomings, and it's going to be a great balance between all these things.
Yes, I think so. And on that note, Parag, thank you so much for taking time. I know it's a very difficult time for many. Our thoughts obviously are with all of our colleagues and friends and families abroad. So we wish you the best, and I do hope that we will one day soon be able to see each other and get on a plane and actually visit. Well, let's hope that happens.
Yes, thanks, Mohit, and looking forward to being in touch with you and hoping to see you physically sometime soon.
Absolutely.